Let's take a look at some of the symptoms you might experience with the rotator cuff tendinitis. Pain and swelling, which you mentioned, Phil. Limited motion, obviously, can't do everyday activities. Weakness of arm. Would it be all of those, maybe just a couple?
It could be a combination of, it could be all of the above. Usually the limited motion and weakness all is secondary from pain. If the rotator cuff is completely torn, then it's not functioning. That's why you get the weakness. But in our scenario, we're talking about more like overuse, inflammation kind of a situation. The reason you can't lift your arm or the reason you can't is usually secondary to the discomfort or the pain.
I know a lot of people that can really withstand a lot of pain in their lives. So when do you say you need to go see a doctor? Because, you know, some people are tough.
Yes, this is true.
A little too tough.
Yeah, we love hearing the line that patients have a high tolerance for pain, and usually it ends up being true. But if you've modified your activities, let's say you've reduced the overhead activities, you've tried over-the-counter anti-inflammatories, and you had persistent pain for, let's say, several weeks without improvement or worsening, then I think at that time you need to go see a healthcare professional.
How is it treated?
So usually the treatment, as Dr. Selznick had said in his video, it's modify the activity. So reduce the overhead activity. So let's say if it's swimming, we stop swimming for the time being. Work on strengthening the musculature around the shoulder, usually in formalized therapy or home exercises. We'll do some over-the-counter or prescription strength anti-inflammatories. And depending on the severity of the inflammation, we may even use a corticosteroid injection into the shoulder. Very rarely do you need to do anything surgical for this.